Good afternoon, everybody, and welcome to the February 2021 Executive Director meeting. A little different weather this week than last week. It's great to see the sunshine, warmer temperatures. For those of you that have been at the Heritage for several years, you know that even though our temperatures started to increase over last weekend, that many of us did not relax at all until we had a couple days of warm weather. Because historically, when we've had frozen sprinkler head pipes, we do not know that until we get warmer weather and the ice that broke the pipe thaws, and then we have not the best situation. So we're really happy that we did not have any issues with the pipes this year. So I'd like to kick things off with recognizing Miss Ellen Singer. Miss Singer is the President Spotlight for the month of February, and I'd like to read some of the things that were shared in the newsletter. She was born in Brooklyn, New York. She remained in New York City until shortly before she graduated from college. She earned a bachelor's degree in psychology from Hunter College of the City University of New York. She moved with her husband to Knoxville, Tennessee, where he earned his PhD from the University of Tennessee. Then they moved to Harrisonburg, Virginia. This is where their two children were born. Her husband became a professor at James Madison University, and she obtained her master's degree in counseling. After 17 years in Virginia, her husband accepted a faculty position at Middle Tennessee State University in Murfreesboro, and that is where they lived for 30 years. During that time, she earned a doctorate of education from Vanderbilt University and spent most of her professional career primarily in the mental health and educational fields. She enjoys writing, reading, travel, theater, symphony, and music, and traveling. Before COVID, she enjoyed visiting her son, daughter-in-law, and two granddaughters in Houston, and is looking forward to being able to start doing that again. Her other child, her daughter, lives in Franklin, who was very instrumental in helping her with her transition to the Heritage, which I'm glad she said was happy and successful. An interesting fact she shared with us is that she is a second-generation Holocaust survivor. Both of her parents spent their teenage years during World War II in ghettos, concentration camps, and work camps, including Auschwitz. Her parents immigrated to the United States, became naturalized citizens, furthered their education. She said because of the circumstances descending from Holocaust survivors, she grew up without grandparents, aunts, uncles, and other close relatives. She said despite having only a small family support network, she can recall that her father would say how happy he was to have had the opportunity to live in a free country and pursue the American dream. She looks forward to meeting more people in the community, especially as we hopefully inch out of the COVID pandemic. Glad you're here, Ms. Singer, and congratulations for being recognized in the month of February. The reopening status. I was really surprised when we found out that Williamson County's positivity rate as far as COVID testing increased to 14.9%. I thought with the cold weather, testing sites shut down and people pretty much staying home, so I was a little bit surprised. Rutherford County went up to like 20%. But hopefully with the vaccine we will see these start to drop, but we are definitely still in the red. I want to thank everybody for completing Mark Black's survey to help us figure out what we can do when we reopen Fireside. And Mark will be presenting later in the meeting to discuss and give you some more details about that. Dalen will also be talking about Summerfield and testing and where we're at with that. One last thing related to COVID. I'm asking if you could please refrain from asking our employees if they had been vaccinated for the COVID. First of all, it's protected health information. It's protected by HIPAA. And we really just don't want to put our employees on the spot. We encourage everybody to do it. We wish every single employee did. But the more important thing is that almost every resident did. So if you're vaccinated and you're wearing a mask and you're keeping away from people, just keep doing that. But please don't ask for that private, confidential health information. Thank you. Caught cards. I have not read any caught cards for a while, but I had a really good one here, so I thought I would share that with you. This one was written for Karen Wasson, our concierge. And this one said she was caught in the extraordinary act of being indispensable, which I don't think that is one, but that's a great one. And the person checked every single one of the 10 hospitality promises. It says, indispensable is the first word that comes to mind to describe Karen. A consummate concierge, always smiling, always ready to help, always courteous. She does it all, and in my opinion is the glue that holds this place together. When I first heard we were getting a concierge, I was skeptical that we needed one. Boy, was I wrong. Thank you, Karen, for being there for all of us. These COVID months have not been pleasant, but you sure have gone out of your way to try to keep all of us happy. You're a diamond that always sparkles around here. Thank you very much. And I agree. Thank you, Karen, for everything you do and continue to do. And also thank you for filling out CAUT cards. We really do appreciate that. Our hospitality committee reviews all those. We share those with the appropriate department and employee, and they are very well received. With that, I will say have a great weekend, and I will turn things over to Judy Good.
Well, hello. This is the February 2021 marketing report, monthly marketing report for the Resident Executive Directors Meeting. We have had a wonderful beginning of the year. 2021 has proven itself to be much better than 2020 all around. Even though we did have that terrible ice storm, I'm glad that everybody has been safe during that time here. We are going to be hosting tomorrow, recording this on Wednesday, so Thursday, tomorrow, we're going to be hosting a Life Care versus Rental webinar, and this is one of the feature events that we host each year here at the Heritage, typically in person. This one is a webinar, a Zoom meeting, and we have 69 RSVPs that will be joining us for this event. And we look forward to that, and we're going to invite each one who attends to have a personal meeting with us afterward, not here on campus, but virtually, a personal virtual meeting, and get to know them more. So we're really excited about this event and the prospects that are coming through and interested in knowing more about the Heritage. We also have another event coming up. If you have friends who are thinking about the Heritage, this is a very good event to invite them to. It is a webinar. It will be on March 18th at 2 p.m. Brad Breeding is a financial planner who is well versed in senior living and has been really partnering with LCS communities for the last 7 years. And he presents a very comprehensive case for life care communities, and his presentation will be on March 18th at 2 p.m. If you have a friend who's interested in knowing more about the Heritage, this is a very good informative session to participate in. And which brings me up to another point. We're going to be looking at the resident referral program again, and just making it a little better. So more to come in the next few months about that. So far this month, we have had a few sales. Year to date, we have had 2 sales in existing inventory, and we've had 3 sales in the initials or the Redbud building of places that have never been lived in. We've had 2 closings so far, and we have a few more closings. We have one actually tomorrow, and then we have another 2 in March, and maybe one in April. So we're looking forward to seeing new folks coming into the community. The other things that are going on, please go on Facebook. Susan Leathers is helping us out with Facebook. She's our PR partner, and she has been, as you can see, you have seen Susan around the community taking photos and posting them on social media. So get on social media, like our page on Facebook, go to Instagram. We also have a YouTube page. We're also on LinkedIn. And share that with your friends and your adult children, and that gets the word around, and it showcases the community to everybody else. So I look forward to seeing you again next month, and have a great rest of your February.
Good afternoon. Today, first, I would like to talk about our positive percentage rate in the county. Currently, our county's positive percentage rate for Williamson County is 14.9. We are in the red. We have to be below 10% to be in the yellow. Once we go back below 10%, visitation can start back up in the health center. One of the things I also want to address, but related to our positive percentage rate and visitation in the health center, is you may have heard this week from our commissioner of the health department state that on February 28th, visitation could start back and freely open up within the nursing facility. The State Department of Health and our commissioner should be putting out a press release saying that that information is not accurate and it will not be freely opening up come February 28th. The state has to, for nursing homes and assisted livings and homes for the aging, are going to use the CMS, Centers for Medicare and Medicaid Service regulations. The state has decided to not use the state regulations but also follow the more stringent regulation, which will be CMS's regulation that the nursing side of Summerfield has been following for this whole past year, which states that our positivity rate in our county must be below 10% if we want to have visitation, which is outdoor visitation or in a booth visitation with your loved one. Now, our county again is at 14.9, so visitation will not resume this week. We also need to wait until Monday to see if our county drops below 10%, puts us in the yellow. Then if we are below the 10% positivity rate for the county, then we will open up visitation, have slots available. If it's nice outside, we'll have outside visitation resume. If it's bad weather, hopefully not like we had last week, but if it's raining or a little cool, we'll have a visitation and a visitation booth set up in Summerfield for both assisted living and the nursing side of Summerfield. Now, we may see some changes over the next few weeks from CMS on how visitation should occur. Right now, we're still stuck using the positive percentage rate. Again, I want to repeat that again, we are not using whether someone's been vaccinated, both doses, or not vaccinated. It is based on the county's positivity rate, not the vaccination of the individual, because we do have employees that are not vaccinated in the health center, and we do have residents that only have one dose of the vaccine, and we have a lot of residents that have both doses of the vaccine, but we do have some residents that have no doses of the vaccine. These are residents that were not in the long-term care, nursing, assisted living setting at the time of vaccination, so they have not received a dose, and we'll work with the health department on getting them a dose if they choose, but the visitation is not based on, at this current time, based on whether someone has the vaccine or not. It's based on the county's positivity percentage rate. Therefore, again, a reminder, right now this week we're not allowed to have any visitation. Hopefully next week we will below that 10% positive percentage rate for the county, and we'll be able to resume some limited outdoor visitation and also start up communal dining and communal activities. We're looking good because our numbers for this week and the last several weeks have been really good related to positive counts in the nursing side. We again have no positive employees and no positive residents for the COVID-19 virus. So if we can continue that up, then we will definitely be able to have visitation once we go back into the yellow and we have no positives. So we're working very hard to make sure that we don't have any positives, so we can have that visitation once our county hits yellow. Well, the other thing I would like to talk about today is our vaccination clinic, which will be held on March the 8th. We have some employees, some residents that received their first dose a few weeks ago, and then they will receive their second dose on March the 8th. It will be a shorter day. It'll probably be between 8 and 12. We'll definitely let everybody know on March the 1st when they need to come to Popular Hall, and those are residents and employees that are in Summerfield, where they need to go on March the 8th for their second dose of the vaccine. So again, on March the 8th is the day that we will have some Walgreens representatives, pharmacists here on site to administer the second dose of the COVID-19 vaccine, Moderna vaccine, to our residents that have received the first dose on February 8th, and now they're going to receive their second dose on March the 8th. So we're looking forward to that. Any other residents going forward after March the 8th or currently right now that have not received their first dose, those will have to be arranged with the health department. And if you'll contact me or the receptionist, we will give you a link so you can sign up for that if you choose, or new residents coming in or new employees that we hire that choose to receive the vaccine. They will have to get their first dose at the health department, and we can get them on the list to do that. But for those individuals that receive their first dose on February 8th, and we'll be able to receive their second dose on March the 8th, and we will call you and set you up a time between 8 and 12 on March the 8th. Before I leave you, I want to remind you, even though you may have your second dose of your vaccine and it's been past 14 days of that second dose, I want to remind you, please continue to wear your mask, social distance, and wash your hands with soap and water or hand sanitizer if soap and water is not available. Be safe and be careful out there. Thank you.
Hi residents, this is Kathy Joki, Director of Resident Health Services, and here we are headed toward the end of February. Hard to believe. Today it's like spring, and last week we were snowed in. So that's one thing about Tennessee is if you blink your eyes, the weather changes. It's never a dull moment. So last month I talked about Summerfield. I got a lot of feedback after that meeting and that video, and I just want to touch on a couple things that I said again very quickly. Just a quick review. Basically, admission into Summerfield takes pre-planning. It is a licensed health center, mandated federal state regulations, and it takes pre-planning to get in there. Our residents always have first priority placement. When they need it, they're given a private room over there. But to be admitted is a process, and you have to have a history and physical and admission orders written by a physician or nurse practitioner to be admitted into Summerfield. And those history and physical and admission orders cannot be over 30 days old. So that brings up why it is so important for you to still get established in the clinic. Because if you are established in the clinic and something here comes up unforeseen with your health, and yet you have not seen your primary care doctor in 6 months, and you need to be admitted into the health center, it helps us and will help you and will help the clinic getting you admitted, because if Angie or Rupa has seen you and you're in their system, then we can get a quick appointment where they can see you and help us get what we need to get you admitted. So they have a new patient packet, and you have to fill that out, and then you call the clinic at 615-564-4953 and make an appointment to get established. Okay? Basically, there's no easy way to explain if you will be covered in the Summerfield under your insurance, your HMO, your Medicare, or if you will be over there under your Life Care days. What happened and what worked, 5 years ago doesn't work today, even if your insurance is the same way. Today, the regulations have really are stricter. And when you get into the hospital, we have brought up that you need to ask if you're in observation or if you're admitted. If you have standard Medicare, you cannot be admitted under skilled nursing unless you are admitted into the hospital for 3 midnights. And then, even if you have been admitted for 3 midnights, does not necessarily mean that automatically will give you skilled nursing where your Medicare will pay for you. We have to be able to treat you for what you were hospitalized for. So for instance, and this is maybe the easiest way, if you were hospitalized for a bad urinary tract infection and you were in the hospital admitted for 3 or 4 days and they gave you IV antibiotics, you're thinking, okay, now I can go to Summerfield under my Medicare because I had a 3-day admission. But guess what? During that 3 or 4 days in the hospital, those IV antibiotics cured your urinary tract infection. So we don't need to treat you for that. Now you're just weak. And Medicare will not let us skill you because the problem was resolved in the hospital. So there are a lot of factors that are looked at to see if you have a diagnosis that we can treat you for. Were you admitted for 3 days? Is this just an exacerbation of a chronic condition that you have? Or is this a new onset of something that Medicare feels that you need skilled nursing for a short time? So I can't explain to you. All I can tell you is we are here for you when you do have an occurrence and you do go into the hospital and you do let me know, and we do follow you, and we do talk to the hospital, and we find out at the time of discharge whether you're going to be skilled in Summerfield or whether you don't meet skilled criteria, but you're going to be over there under your life care days. I'm not going to go into big detail on the life care days today, but it's in your handbook explaining your 90 temporary days. And if you have any questions, feel free to reach out to me, and I'm happy to explain it to you in more detail. Another thing I'd like to mention today is, we're in the tax time. I am starting to receive calls from family. The visitation policy here, restriction, has not lifted yet. I know we've had both doses of the vaccine. We hope sometime in the future that things will change. But for now, families asking me if they can come in, if they can gather documents in your apartment to be able to do your taxes. And the answer right now is no. The visitation policy here, the restrictions are still in place, and family is not allowed in to gather your paperwork. Now, so I'm asking you as independent living residents to please start getting, if your adult child does your taxes, please start finding your information, gathering your information, and getting it to where they can come by and we can get it to the guard gate and they can pick it up, or they can pick you up and the paperwork and take you to their place and complete your taxes. Something to consider, what a lot of residents have done is their adult children they change their address and receive their financial information and statements. So you continue to get your mail, but important financial papers that they might need for taxes or to write your bills or something like that get those addresses changed to your adult child. And then that's not a problem, because we don't know what the future holds here. I mean, honestly, we never thought we would have the coronavirus and, 2020 into 2021. I can't tell you what the future is going to hold for visitation and things like that. We're hopeful, but we don't know yet. So you've got to kind of plan ahead and maybe let them take over some financial things or change your address where things get mailed to them. And that would be very, very helpful and for your adult children. You need to understand that everybody should be wearing their badge key. The outside doors by the clinic and going into the Healthy Life building and going from the outside doors of the Magnolia building and the front clubhouse and those doors are locked. And they are locked because we're not going to just open up the community to anybody walking in. It would compromise the security of the community and our residents. So these doors are locked. You are told to always wear your swipe key, and you just hold the key in front of the door and the doors will open. I do have people coming down here for appointments in the clinic, for lab work, and they don't understand why the door is locked. And the door is locked because all the outside doors are locked. And you need to wear your swipe key every day so that you can get in and out of the Healthy Life building, the clinic, all the different buildings. So I hope, if you can help pass the word with your friends if you don't see them wearing their badge, that they really, really need to. I would like to quickly, new residents that live alone, residents that are high risk for falls, there is an additional pendant that we can order for you. There's a one-time charge of $295. This is the pendant, and you just wear it around your neck underneath your clothes. The battery is good for 5 years, and security comes and they hook this into your pull cord in your apartment. Anywhere inside your apartment, your home, if you fell in the living room, the kitchen, you would push this 1, 2, 3, and that will activate your pull cord, just the same as if you pulled the cord. It does not work outside your apartment. It does not work if you're down here in the clubhouse. This is for inside your apartment. If you were in the shower, if you were in the living room, in the kitchen. And this is a very, very good thing to have, especially if you're a high risk for falls, you live by yourself. You would contact me and I order these for you. And that is how the Heritage communicates very important messages to the residents. You need to get familiar with them. If you need Ashley Burnett to help you, or I can help you, or Michael in IT, or Ashley Emerson, we're all happy to assist in explaining Touchtown and 920. But we are communicating, but you need to watch these communication pieces so that, John Taggart's, Dalen, they put important messages on there about how things are changing and updates. And if you're not watching those, then you really don't know what's going on, and you really don't know what the current rules are or changes, progress. So please get familiar with Touchtown, watch Channel 920, and then communicate what you learn with your families, and that would be extremely helpful. Labs are Monday and Thursday. Now, if Monday falls on Labor Day, Memorial Day, it's a holiday, they do not come on Mondays. If it's Thursday and it's Thanksgiving, they do not come on holidays. But typically, if there's no inclement weather, the lab, Williamson, has a phlebotomist come on Mondays and Thursdays at 9 a.m. sharp. They're here at 9 a.m. and they draw everybody that has an order, or you can bring a handwritten order with you from your doctor. They'll draw the lab, they'll take it back to Williamson, and they'll process the lab. Unless you have an insurance that, like Cigna Health Spring, some of the others, that will not approve the hospital to process the lab, and they have to send your lab out to LabCorp. So then they send the lab out to LabCorp. They still draw it here for you as a courtesy. It goes out to LabCorp. Could take a little longer getting that lab back because it had to be sent out to another lab company to process. But it's up to you to touch base with your doctor to get those results. We do not get the results back here. Those results go to your ordering physician, and you follow up with them. You can have a lab faxed to me at 615-564-4891, and then I will put the lab in the lab book so that it is here for when you come down. So yes, your doctor can fax me a lab. I'll put it in the clinic, and then when the phlebotomist comes, your lab order is down here. So that's about all I have today. The good news, I'm going to end on a very positive note. 18 days, we turn the clocks forward, spring forward, and we will have another hour of daylight. Yay! And also, in 3 weeks, just 3 weeks, is the first day of spring. I cannot wait. Thank you very much. I can't thank you enough for everybody hanging in there through these challenging times. It's been a work in progress for everybody, and you're very much appreciated. Bye for now.
Hey, good afternoon, everybody. It's Ashley Burnett, Director of Community Life Services. I hope that you have all received your March calendar in your in-house mailbox. I want to make you aware of a few things on the March calendar. Number one, there are several mystery events in March. We are calling it Mysterious March. So, a long time ago, pre-pandemic, mystery outings were really popular here at the Heritage. We obviously have not been able to go on outings, and so we want to recreate a little bit of the mystery outing magic on site. So we are going to offer a mystery on site. That's going to take place on Wednesday, March 31st. You will need to sign up for this event with Karen, the concierge, and then if you are signed up, you will meet in the Grand Hall, and we will tell you more about the event. We'll give you a little bit of information, like some hints, but we're not going to tell you exactly what we're going to be doing. Some other things, I know many of you have enjoyed the weekly or bi-weekly deliveries that we have been doing to your home. We've had a lot of fun. It's really fun for our team and a lot of staff throughout the building to come and deliver something to you pretty frequently. So for March, we're still going to offer you some complimentary treats, but you are going to have to come to Steeplechase Lounge to receive your treat. And it's a surprise as to what the treat's going to be. So you won't know until you show up that day, but I hope that that won't deter you and you will still show up to receive that. And we're going to do 2 of those throughout the month. Another thing, there is an insert inside of your calendar. We are playing a life-size version of Clue this month called The Heritage Hint. So you may see some characters and some places in the game that are special to the heritage. There is a check sheet for each of you playing the game that you can keep track of your answers, and you will go around and ask staff if they have a hint card. If they show you their hint card, then you can check that character, that room off, and you will know that combination does not lie in the classified envelope of kind of solving the hint. Some other things that we are doing, or another thing I want to bring your attention to throughout the month, is Tim in the Fitness Center is doing a Fitness Center membership drive. So anybody who is not currently a member of the Fitness Center, but maybe you've been curious about the Fitness Center, curious about what Tim and his team have to offer, you can attend the membership drive and get some more information. That is going to take place on Tuesday, March 16th in Poplar Hall. So any other questions about March, feel free to reach out to me or Amy or Karen, anybody else in Community Life Services, and I hope that you will join us for some of the mysterious things we have going on in March.
Good afternoon, everyone. I want to give you an update today on the food and beverage and opening of the Fireside Grill, so some good news there. First, I would like to thank all of you for your patience and understanding last week with the weather events that we had. It was a bit of a challenge for all of us as far as staffing, but also as far as receiving products. We weren't receiving any of the food products that we needed, but we made it through. Hopefully we're through that. I also want to thank everyone for participating in this survey. Those of you that participated, we had a lot of participation. That was great. That feedback is very valuable for us. And with that being said, I want to announce on Monday, March 8th, we are reopen the Fireside Grill. We do want to reopen for both lunch and dinner. Right now it'll be Monday through Saturday. We're still working out the times and all of that. We plan to continue the delivery program as well as the grocery program, the same as we've been doing as well. So we want to accommodate those that aren't comfortable coming to the dining room yet, and that's certainly understandable. Some of the things that we had in place prior when we reopened will still be in place where staff will be required to wear masks, and we'll still take temperatures. Residents will still be required to wear masks in and out of the restaurant, but obviously can remove the mask when dining. We are looking to increase the capacity, so based on feedback, we are looking to add a certain number of four tops to the restaurant this time, which I'm sure will be welcomed by many of the restaurants. It will be reservation only. We will continue to sanitize all tabletops, chairs, in between seatings. We do not want residents gathering at the front of the restaurant, so it will be by reservation only. We'll have more of that to come out. We are adjusting the seating in the restaurant currently so we can put together a reservation template, and there'll be more information coming out on that. But a memo will be distributed. It'll have more of the details. Certainly if you have any questions once that memo comes out, please feel free to reach out to me. That should be coming out hopefully tomorrow, if not by Monday. And in that letter will be information on the reservations and when those will be opened up. Certainly Karen, the concierge, will still be able to help with the reservations, and you'll also be able to go on Yelp reservations as you previously did. But thank you for everything that you've been doing to help us, and we look forward to having you back into the restaurant and to see all of you. So thank you very much. Have a great day.